Good evening, everyone. As we recognize and celebrate National Rural Health Day, it is my pleasure to welcome you to Lucas County Health Center's annual community presentation. My name is Lisa Junkman, and I am the chairperson for Lucas County Health Center's Board of Trustees. We are excited to not only celebrate rural health care and its significance, but also share information with you about the ever-evolving healthcare landscape in Lucas County and Iowa. At Lucas County Health Center, our team is committed to the well-being of our community. We recognize the unique challenges and opportunities presented to us as rural healthcare providers, and tonight we are here to showcase the ways we are constantly evolving to meet those needs. At this time, I would like to recognize some of the leaders who are working to shape the landscape of healthcare at Lucas County Health Center, the Board of Trustees and Senior Leadership Team. The Board of Trustees are dedicated volunteers who generously donate their time and talents to the facility and community. These folks are truly behind the scenes and work to ensure our community's healthcare needs are met and that expectations are exceeded. My fellow trustees are Natalie McGee, Vice Chair, Lana Kubal, Secretary, Sheila Lang, Treasurer, Mike Miller, Fred Steinbach, and Randy Westman. Thank you for all the pivotal role you play in steering the Health Center forward. Additionally, we would like to recognize the Senior Leadership Team, comprised of seasoned experts in their respective fields and roles. They provide the vision, strategy, and direction that guide the hospital day in and day out. Members of this team are Brian Sims, Chief Executive Officer, Jay Christensen, Chief Financial Officer, Lori Johnson, Chief Operations Officer, Joni Hannon, Chief Nursing Officer, Dr. Kenneth Anderson, Chief Medical Officer, Amy McCurdy, Chief Clinical Officer, and Stephanie Baer, Human Resources Director. Thank you, leadership team, for your dedication to providing our community with top-notch patient care. Throughout tonight's presentation, you will have the opportunity to hear from local experts and healthcare leaders who will share their insights on rural healthcare, innovations, and the importance of community collaboration. Our speakers are not only experts in their fields, but are also passionate advocates for the betterment of the healthcare in Lucas County and beyond. Before I pass the microphone over to Chris, I would encourage you, the viewer, to actively participate, ask questions, and share your thoughts. This event is just not about informing, but also about listening to our community. Whether you're joining us live or watching days or weeks following the broadcast, we would encourage you to leave your feedback. At this time, I would like to introduce Chris Mitchell, President and CEO of the Iowa Hospital Association. Chris is here with us today to share his expertise and insights on healthcare across Iowa. A healthcare leader in the state, he is a passionate advocate for healthcare excellence and plays a pivotal role in advanced healthcare initiatives in Iowa. Please join me in welcoming Chris.
Thanks, Lisa, for the warm introduction. My name is Chris Mitchell, and I am President and CEO of the Iowa Hospital Association, or IHA. The IHA is an organization that represents 115 hospitals across the state of Iowa. Given the demographics in Iowa, we are focused on the delivery of rural healthcare across the state. Of our 115 hospital members, 82 are critical access hospitals, which are required to be in designated rural areas. 82 critical access hospitals is the second most of any state in the country. Half of our hospitals are public county or city hospitals, and half are private nonprofit facilities. At the IHA, we are focused on delivering services to hospitals under three major pillars: advocacy, education, and information. At the IHA, we are proud to serve as the junkyard dog for our members by advocating on their behalf at the state capitol in Des Moines and also in Washington, D.C. with Congress. We also mobilize our membership for grassroots advocacy, helping hospital employees and hospital board members connect with their local legislators. This is a critical component of our advocacy efforts, as elected officials need to also hear from folks in their communities across the state. I will talk more about our advocacy work in more detail in a little bit. Through IHA education efforts, we offer valuable programs that empower hospital leaders and staff. In 2023 alone, new education-focused membership groups were formed for hospital emergency preparedness, compliance, and cybersecurity professionals, furthering our mission to be the primary convener of hospital thought leadership in the state. Through our information center, we manage all of the hospital inpatient and outpatient data in the state for hospitals and the state of Iowa. We are proud and happy to provide that support to our members. Looking at the healthcare landscape in the state, we have to look no further than a recent survey we sent our members. The top 13 issues identified by hospital CEOs across the state were related to either workforce or financial challenges. And that trend is what we are seeing across the country as well. As a result of these challenges, we have seen 11 rural hospitals across the country close this year. Fortunately, none within the state of Iowa. Given the continued hard work and dedication of hospital leaders across the state, we've only seen one hospital close in the last 20 years, while the rest of the country has seen almost 200 hospitals close during that same time frame. Despite the hard work, the financial pressures remain high, particularly on rural hospitals. In most cases, they are the lifeblood and largest employers in their communities, which means that a financially healthy hospital is vital to a healthy Iowa. Looking specifically at the state, the financial picture for hospitals was challenging pre-COVID, but the pandemic exacerbated the situation. Currently, more than half of Iowa's hospitals have negative operating margins, which has jumped from 45 to 65 of our 115 hospitals just over the last 4 years. Much like other industries, inflation has caused labor costs to skyrocket by $500 million and drug costs to increase by 60% since 2019. There has also been a healthcare workforce shortage across the country. The healthcare workforce is critical for hospitals to deliver high-quality care 24/7, 365, so the difficulties in recruiting and retaining staff has been felt at hospitals in the state, particularly for our rural facilities. Currently, there are almost 10,000 full-time and part-time openings in Iowa hospitals, with nurses accounting for just about 40% of those open positions. Lab techs, radiology techs, ultrasound techs, certified nursing assistants, and respiratory therapists round out the top 6 openings around the state. Healthcare workers across Iowa and the country are reporting an increase in instances of violence in the workplace at an alarming rate. This, among many things, weighs heavily on the healthcare heroes that take care of us every day. I know this information and data points paint a daunting picture, but I believe there is reason for optimism. Iowa's hospitals have strong leadership, committed in caring healthcare providers, and enjoy strong support and commitment from their communities. In addition, our state and elected officials have been tremendously supportive and continue to work with IHA and our member hospitals on policy solutions to address these unprecedented challenges. To that end, earlier this year, landmark medical liability reform legislation championed by the IHA and our member hospitals that caps the amount of non-economic damages was signed into law. Passage of this legislation controls costs of liability insurance and creates a level playing field when it comes to recruiting and retaining healthcare workers with other states across the country, while creating a better environment for clinicians here in Iowa. IHA and Iowa hospitals were also successful in advocating for a new rural emergency hospital designation, which IHA and our members have worked on since long before its inception at the federal level, and we are pleased that hospitals now have another tool at their disposal as they continue to adapt in this ever-changing healthcare environment. Most notably, we recently received approval from the state and federal government to implement a directed payment program through Medicaid in the state of Iowa. This will provide the first increase in Medicaid payments to the hospitals in Iowa in more than 10 years. The funding support for Medicaid is long overdue, but will go a long way in helping hospitals navigate the challenges ahead. I certainly appreciate the opportunity to speak with all of you today, and I am proud of the work that Lucas County Health Center and the hospitals across the state provide to their patients and communities. I hope you enjoy the rest of the event. Thank you.
Thank you, Chris, for providing us with a comprehensive update on healthcare in Iowa. Your insight shed a light on the broader healthcare landscape and gives us a clearer picture of the challenges faced by all hospitals in Iowa. As we move forward in our program, I am honored to introduce our next speaker, Mary Grismore, Nurse Administrator at Lucas County Public Health. Mary is an important part of the healthcare landscape in Lucas County and has served our community for more than 20 years. Tonight, she will provide you with an update about the most recent Community Health Needs Assessment and the impact it will have on the health of our community. Please join me in welcoming Mary.
Thank you for the warm welcome, Lisa. Every 5 years, Lucas County Public Health and Lucas County Health Center partner to complete a Community Health Needs Assessment. This process allows the two organizations to work together to identify the health concerns and needs in our community. It also serves as a roadmap to help us develop strategies that address these challenges, expand access to health care, and improve the overall well-being of our entire community. While community health needs assessments are conducted in every community, the results are a direct reflection of the needs and challenges of the communities being assessed. For Lucas County, our most recent survey has shed light on 5 particular health issues that require our focus. These include mental health, insurance gaps, transportation, skin cancer, and blood pressure. While some of you may be familiar with these health needs as ongoing concerns that have existed in our community for years, others may view some of them as newly emerging issues. To gain a more comprehensive understanding, I like to share more insight into each focus and explore the strategies we are implementing to address them. Mental health. Mental health and substance use has long been a concern in not only our community, but across the nation. It affects people from all walks of life, and we recognize this issue will require sustained effort. To begin addressing it, we've set a goal to host 3 community education events each year for the next 5 years that focus on mental health. These events will feature mental health first aid training, community Narcan training, and outreach to educate healthcare professionals and law enforcement about the Handle with Care program. Through these education efforts, we hope to reduce the stigma around mental health and substance use and improve the understanding of how to effectively respond to mental health crises. Insurance gaps. The issue of insurance gaps has persisted and likely even grown in the last year and has a major effect on access to vital services. Over the next 2 years, our goal is to reduce the rate of uninsured community members to 5% or less. To achieve this, we will promote available services, assist residents with enrollment programs, and provide comprehensive resources regarding coverage options within our community. Transportation. Transportation barriers are not a new concern for our community. It is estimated that 9% of our residents lack access to a reliable vehicle, making this a significant obstacle to better health. In the next 5 years, we will actively work to educate our community about available transportation resources, explore ways to increase free transportation options, and work with healthcare staff to foster open discussions on transportation needs. Skin cancer. It will come as no surprise to most of you that our community has a significant population of hardworking farmers and blue-collar individuals, most of whom are men. The prevalence of skin cancer amongst this group has become a noticeable concern. Therefore, our goal is to reduce skin cancer by 1% among this population. We hope to address this concern by offering skin cancer screenings, providing sunscreen to vulnerable populations, and collaborating with local businesses and organizations to reach our blue-collar workforce. Blood pressure. High blood pressure affects a significant portion of our community, as indicated by the assessment. In fact, 58% of participants expressed the need for regular blood pressure screenings to help maintain their family's health. With 57% of our Medicare population already diagnosed with high blood pressure, this need is a priority, and we are striving to reduce high blood pressure rates by 5%. By offering free blood pressure checks and hosting educational events at least once per year, we hope to meet this goal in the next 5 years. The complete report for this year's survey is readily available and accessible to all, both on Lucas County Public Health's website and Lucas County Health Center's website. It offers readers more in-depth knowledge, including an analysis of our community demographics and the methodology used to complete this assessment. We encourage all of you to download a copy of this report for a more detailed understanding of the health needs of the community. As I conclude, I would like to thank everyone who participated in the assessment. The feedback is invaluable and is vital to our efforts to improve the health and well-being of our community. Thank you.
Now, as we move closer to home, I am pleased to introduce our next speaker, Brian Sims, CEO at Lucas County Health Center. As a healthcare leader in both Iowa and Oregon, Brian's leadership and dedication have been instrumental in shaping the direction of healthcare. Tonight, he will shed light on Lucas County Health Center's strategic plan and offer insights into the hospital's vision for the future. Please join me in welcoming Brian.
Thank you, Lisa. I am honored to have this opportunity to share this portion of our National Rural Health Day presentation. At Lucas County Health Center, there is one goal: to ensure that our patients and their families feel just a little bit better going out the door than when they came in. To stay focused on that goal, the Lucas County Health Center Board of Trustees has approved a 5-year strategic plan. Our vision is guided by our core values. Those core values are integrity, teamwork, stewardship, excellence, dignity, and hospitality. These 6 core values are the guiding light, our true north. The co-founder of the Walt Disney Company, Roy Disney, said, "When your values are clear, making decisions become easy." The facts are we continue to experience pressures in the healthcare delivery space. When those pressures present themselves at the health center, our core values shine brightly in every decision made. The 4 focus areas in our strategic plan are simple. Those areas consist of the patient experience, the employee and provider experience, the community experience, and financial stability. At the heart of these 4 focuses is communication. It is necessary we listen to the voices of the patient, provider, staff, and community. The goal under the patient experience says that LCHC will improve and align our quality outcomes with the perception of our patients. Well, let me explain that. There are 1,353 small rural hospitals across the United States known as critical access hospitals. Of those hospitals, as recognized by the National Rural Health Association, and as of this summer, Lucas County Health Center scored in the 89th percentile, or the top 11% of all critical access hospitals when rating the quality care delivered to our patients. Additionally, the health center scored in the 78th percentile, or in the top 22% of all critical access hospitals nationally when it came to the patient's perception of care. Just to clarify, Lucas County is one of the top critical access hospitals in the nation, but we are not perfect. Although our ranking is well above the average, we believe we can do better. The only way I know we can do better is by listening to our patients. How can you help? Well, each time you receive services from Lucas County Health Center, you will receive an email, a text, or a survey in the mail asking for your opinion. You can help us by completing the survey and give us your honest assessment. And if we did good, please tell us. I love nothing more than to thank our staff for doing a great job. Rest assured, we will fix what needs to be fixed. And just so you know, the names of our patients that complete the survey are not disclosed to anyone at the health center, but I read every comment. The goal under the employee and provider experience is to create a patient-centered culture where providers and employees work together to serve our communities and become the healthcare employer of choice. Again, it is about listening to our staff. I think we all know that there is a labor shortage across all industries. Healthcare is not exempt. It is important that LCHC recruits and retain the top talent available. In support of our core value, teamwork, we listen to the voices of our providers and staff, and in turn, we have a greater opportunity to remove barriers for a great patient experience. And the final voice is the voice of the community. The community experience goal is to increase the awareness of services while upholding the community's trust. We listen to your voice when we partner with Lucas County Public Health and conducted the Community Health Needs Assessment. It is through your input and conversations we learn what services are most desired in our community. As an example of some of the services we have to offer includes cardiologist Dr. Martin Aronow and Dr. Luke Groban, oncologist Dr. Giselle Mary, and nurse practitioner Rodney Clark can care for your dermatology needs. For ears, nose, and throat, Dr. Simon Wright and physician assistant Dave Wanell can see you here at our health center. We work with Dr. Ian Lynn for all your orthopedic needs, including total knee replacements done here at Lucas County Health Center. There are many other services available at the health center to include wound care, podiatry, clinical pharmacy, and general surgery. Please refer to our website, lchcia.com, to see all the other services we have available to better serve you. And if all else fails, you can see one of our amazing providers in our family practice clinic, and they will make sure you get referred to the right specialist to take care of your concerns. Speaking of our family practice providers, if you currently do not have a family practice provider, I would ask that you give one of our 11 providers an opportunity to become your primary healthcare partner. And if you haven't heard, in September of 2024, Dr. Zach Johnson, not the golfer, will be joining our talented staff of family practice providers. Finally, financial stability. Even for a public hospital, it is vital for its ability to reinvest in the facilities, equipment, and the employees. If you recall, stewardship is one of the health center's core values, but even good stewardship will not stand the test of time. Roofs will fail, equipment will become outdated, and employees need and deserve pay increases. When needed, it could cost well over $1 million to replace or renovate an emergency room, more than $800,000 to replace x-ray equipment, and an ambulance, it could cost well over $250,000. Additionally, we have to keep up with a competitive labor market so we can retain the best talent available. In fiscal year 2023, it cost $29 million to provide our communities with high-quality health care. Of that $29 million, the taxpayers of Lucas County paid $1.4 million, or 5% of our total budget. The Health Center Board of Trustees has not raised the health center's tax levy in more than 5 years. By maintaining a 3% margin, our health center can reinvest in our facilities, equipment, and people, and at the same time keep the tax asking at its current level. Finally, another portion of financial stability will stem from the Lucas County Health Center Foundation. Our foundation will focus fundraising activities that will support the reinvestment strategy into our facilities, equipment, and people. And speaking of reinvesting in our people, the offering that I am most proud of is Shirley's Promise. For the last several years, Shirley's Promise, which was started by my wife, Tracy, and I, selects a Lucas County Health Center employee that wishes to continue their healthcare education and awards them a small scholarship to help cover their educational cost. Shirley's Promise is special to me because it was named after my favorite nurse, my mom. To date, Shirley's Promise has awarded roughly $7,500, and the foundation will make more awards in the spring of 2024. So there you have it. As I said in the very beginning of this presentation, our goal is to ensure that our patients and their families feel just a little bit better going out the door than when they came in. As we celebrate the importance of National Rural Health Day, I want you to know how dedicated your hospital and clinic are when it comes to ensuring you get the best health care close to home. I would like to close my presentation by referring to our number one core value, integrity. Someone wiser than me once said, if you have integrity, nothing else matters. And if you don't have integrity, nothing else matters. Easily put, if there is no integrity, there is no trust. If you doctor at Lucas County Health Center, thank you for trusting us. If you do not, I hope you will give us an opportunity to earn your trust. We will see you again next year, and until then, I hope you have a happy and healthy holiday season. Lisa, back to you.
Thank you, Brian, for giving us a clear vision of the strategic direction Lucas County Health Center is taking to meet the evolving healthcare needs of our community. The compassion and dedication of your team are evident in the work you are all doing. As we leave this event, I would like to once again encourage our viewers to consider what you've learned and how you can contribute to the betterment of rural health. What actions can each of us take in our own lives to promote rural health and well-being? We welcome your feedback and look forward to creating an open dialogue between our organizations and the community we serve. Additionally, I would like to extend my deepest gratitude to our speakers, Chris Mitchell of the Iowa Hospital Association, Mary Grismore of Lucas County Public Health, and Brian Sims of Lucas County Health Center. Thank you again for sharing your knowledge, expertise, and passion with us. And to all of you, our viewers and supporters, thank you for joining us. We hope you are all inspired to take action. No matter how small, we ensure that rural health care remains a priority in our communities. As we conclude, we hope you all feel the same determination we do to shape a better future for rural health care. and we look forward to updating you next year. Thank you.